Seth Kahn here with the podcast on grand challenges. Today, I want to give you some background on Stop Stigma Together, one of the grand challenges I am currently leading. Stop Stigma Together began at the Huntsman Mental Health Institute. In 2019, the Huntsman family gave $150 million to the University of Utah to start the Huntsman Mental Health Institute. They had had success in creating a world-class cancer institute, also at the University of Utah. And so they wanted to borrow from that model to create the Huntsman Mental Health Institute. And this was because one of the siblings of the Huntsman family had died from taking her own life after dealing with a substance use disorder. And initially, the Huntsmans wanted to cover this up. They were embarrassed by it, and they didn't want it to come out that this had happened to a family member. But after some serious reflection, they decided that they wanted to flip 180 degrees and actually use their prestigious standing in their community and the world to bring a spotlight to mental health. And one of the initiatives that they asked for was to eliminate the stigma around mental health and substance use disorders on a national scale, all across the United States of America. This is a big, bold goal, and it's the kind of goal that I get involved with that I call a grand challenge. Now, I've done grand challenges in other sectors. I've done it in finance, earth and space science, medical ultrasound, nursing, currently working on one in physics and medicine. And I could understand how you could have a campaign that would eliminate the stigma for the entire United States. And so I began working with the CEO of the Huntsman Mental Health Institute, Dr. Mark Rappaport. And I gave him my time pro bono initially, and he asked me eventually to lead the initiative. Now, I'm not a mental health service provider. I'm not a mental health expert. I'm not a researcher. But I do have experience running grand challenges. I also have lived experience. My mother developed schizophrenia when I was 10 years old, and that was in 1969, and we were really flummoxed as to what was happening with her. My father was thrown into confusion. He did not get help from doctors, psychiatrists, psychologists, and I, being a little child, was, of course, not in a position at all to understand what was happening. In fact, it was traumatic for me. I was very close to my mother. My mother was deep into early childhood education. She actually eventually got her PhD while she had schizophrenia in this field. But as I was growing up, she was in graduate school. And of course, I was one of her main test subjects. And so I got very close to my mother through this testing. And one of the great gifts my mother gave me was I associated taking tests with my mother's love, which made me want to take tests. And that did very well for me in high school and college. Nonetheless, when I was 10 years old, my world fell apart. My mother, who had been my reliable interpreter and guide out in the world, started having both audio and visual hallucinations, and she became paranoid and unreliable. And then doctors started getting involved, and the medication she was given would knock her out or make her maniacal. It was just really, really a horrible experience in our home. And I ended up leaving home when I was 16. And then when I turned 40, which was 25 years ago, I went in for treatment for a generalized anxiety disorder, which I have successful treatment for to this day. So I had this lived experience, but it was just a data point of one. It was just me going through my own experience, and it was not understanding the field. So when I started leading the grand challenge to eliminate stigma, I started getting an education about really what's going on in the field of mental health and substance use disorders. And it's striking. There's a tremendous amount of progress. There are amazing breakthroughs. I also found a book, which I like to tell people about. You can download it for free on the web. It's produced by the National Academies of Science, Engineering, and Medicine, and it's called Ending Discrimination Against People with Mental and Substance Use Disorders. And it's got a game plan in it for how to eliminate stigma. And it says that it'll take about 20 years and an organization that will take on the coordination at a national level. Well, that's Stop Stigma Together. This initiative that I'm leading, that's what we stepped into, and that's what we stepped up to lead 3.5 years ago. You can find us on the web at stopstigmatogether.org. You can also join our community, which is free to join. Anyone can join at sst.community. Just type that into your browser and it'll take you there. And through a quick registration process, you can be inside our community. But let me talk to you about how Stop Stigma Together works. How do we lead a grand challenge to change the way Americans, all Americans, view mental health and substance use disorders? Well, there are three primary dimensions. There's structural stigma, social stigma, and individual stigma, and all of them need to be addressed for us to be successful. Structural stigma refers to laws and policies. So when I say laws, I mean legislation at the local, state, and federal level. We know that stigma is embedded into many laws, so that means we have to amend those laws. And we know that some laws, for example, the laws demanding parity between mental health and physical health, have already been signed into law but are not being followed. And so compliance becomes a greater issue when it comes to parity. We also know that policy uh, can provide structural reinforcement or inhibition when it comes to stigma. And so that means workplace policy or scout troop policy or place of worship policy. Anywhere that there are rules for how people get along, we need to take a look at policy. So, for example, we are right now just concluding a mapping of the laws of the state of Illinois to identify all the laws that would perpetuate stigma or would combat stigma. And then from that, we can make recommendations to the state about how to proceed so that it becomes a mental health friendly state. We can also create a scorecard that we can use for the other states and territories in the United States. I'm very excited about that work. That's structural stigma. We also know that most people are not interested in doing a deep dive into the root causes of a particular issue, but they are interested in being compliant at their places of work. They don't want to violate any policies. So, just by having the right policies in place, you can have tremendous impact on people across the nation. So that's all about structural stigma. Let's talk about social stigma. Social stigma is how people interact with each other anywhere that they do interact. So it could be in living rooms, could be on the street, could be in shopping malls, churches. It could be any places of worship. It could be the workplace, any place where people are engaged and there's give and take back and forth. We want to look at how people talk about mental health and substance use disorder and be sure that whatever we're doing, that we are fighting the stigma so that people can speak out and get the help that they deserve. The last area is individual stigma, the stigma that occurs in the privacy of our own brain. I can give you an example from my own life here. I was embarrassed by my mother's schizophrenia. And even after she got good medication, when the last 8 to 10 years of her life, she was, 95% normal. The medication was doing a great job of attacking the schizophrenia and allowing her to lead a normal life. Um, Even then, I remained embarrassed by her behavior. And I remember in particular a dinner with my father-in-law and his partner and my wife. And my mother's hair was a little bit askew. She had some stains on her blouse that she wasn't cleaning up. And I felt tremendous humiliation. Now, there was nothing in her behavior for me to be embarrassed by. She was holding her own in the conversation. She was a very smart woman. She was involved. She was loving. She was caring. Um, and nobody else felt the way that I felt. My father-in-law, the woman who was his partner, my wife, were all fine with my mom. It was all happening in my head. And so I took that into therapy because I recognized that the stigma in my own mind was actually keeping me from experiencing the love I had for my mother. And I wanted to deal with that. And I did. And I was able to confront some of the thoughts that I have and change the way I thought about my mother so that I really could enjoy her presence and interact with her in a loving way in the last few years of her life. But that's individual stigma. And it's critical that we not see stigma as a character flaw or as though it's something to be ashamed of. You know, you wouldn't be ashamed if you had to go to the ER for a broken leg or you went to your doctor to manage your diabetes, but people are embarrassed or feel ashamed when it comes to seeking mental health support. And that's something that we've got to change. So those are the three dimensions that we work on. We do this we have an annual summit, which is well attended last year. It was really a great place to be. We have keynote speakers, we have presentations, many of our partners, and anyone can become one of our partners. There's no barrier to entry. Many of our partners did presentations. It went exceptionally well. And we also did a Children, Youth, and Family Summit in New York City in October of 23. So we put on these events where professionals can come and gather and share resources and learn about each other. We also have task forces. And I'll name some of the task forces we have. We have the Children, Youth, and Family Task Force, Criminal Justice, Rural, Policy, Workplace, Journalism, Entertainment and Media. All of these are task forces that are designed to bring together players. So, for example, in the Entertainment and Media Task Force, we have showrunners, writers, actors, producers working side by side with mental health professionals who can give them advice on how to accurately represent somebody who's having a mental health challenge and make sure that the media is doing a good job of not creating stigma, but eliminating it. And so these are our task forces, and they're populated by people who care deeply about these topics. There's also the Marginalized Community Task Force, which includes people who are working with specific Native American tribes. They're working with populations like Black urban youth or Hispanics or Asia Pacific Islanders. There's a whole variety. I mean, there's as many different marginalized communities. They can't all be put in one box, and they certainly don't have a one-size-fits-all treatment. So what we do is we support the leaders who are working with these marginalized communities. And that's how that particular task force works. So if you're interested in any of those task forces and you'd like to join, just send me an email. I can be reached at seth@visionaryleadership.com or go to stopstigmatogether.org, and there's a place where you can demonstrate your interest and ask for more information. But this is how Stop Stigma Together is working. So we're now in the fourth year. We have all of the major mental health organizations participating with us: Mental Health America, NAMI, the American Psychiatric Association, American Psychological Association. We have organizations that are active with youth, like the JED Foundation on college campuses and high school campuses, Shatterproof, that's doing amazing work with helping people to figure out how to address addiction and also to get the help that they need so that their families are cared for as they address it. We have Black Psychiatrists of America on our National Leadership Steering Team, the National Eating Disorder Association, the Carter Center. The Carter Center has had a program in place for almost 30 years to educate journalists about how to write about mental health so that they don't cause more stigma or cause contagions. How do you write about someone who has taken their own life, or how do you write about a shooter without it becoming something that will spread? These are the kinds of topics that the Carter Center focuses on, and now they have an amazing cadre of fellows across the country who've been through their program and are supporting each other and supporting other journalists. Um, so we're really on a multi-pronged approach here, reaching out. And why are we doing this? Because stigma really has a big impact on our society. Stigma literally kills. There are people who need mental health treatment and are not getting it because they're embarrassed or because they're judgmental of others who need the treatment, and they don't provide the necessary compassion or comfort or help them find the resources that they need. We also know that stigma and mental health in general gets much less funding than physical diseases, and so that's a consequence of stigma. People don't go into careers where they are mental health service providers because there's stigma associated with it. So there's a lot of reasons to fight stigma. And we are living through a period where mental health in America is increasingly of interest to everyone. And we see headlines on the newspapers all the time, whether it's the LA Times, the New York Times, the Washington Post, the Denver Times, Seattle Times. All of the major newspapers have been covering athletes who are active in the mental health space, like Simone Biles. They're covering the needs of workplaces and states that are asking for support with mental health. They're really providing, a reflection of America's concern around mental health. And so now's the time to act. Now's the time to do this. And one of our key partners, I want to point out, before we're finished here. Actually, two of them. One is the Ad Council. The same people who did Rosie the Riveter or Smokey Bear are now doing Love Your Mind. And the Love Your Mind campaign is getting great results. And you can find out about it and see the PSAs as well as mental health resources at loveyourmindtoday.org. You can also see the work of the American Psychiatric Association Foundation's Mental Health Care Works campaign, which is showing in cities across the United States. If you go to mentalhealthcareworks.org, you can take a look there, and you'll find all kinds of PSAs and resources that the American Psychiatric Association Foundation has put together. Um, so there are so many partners that are involved with this initiative, hundreds at this point, and soon to be thousands, that I hope if this is something that is of interest to you, that you'll reach out to us. But this is not a PSA for Stop Stigma Together. This is a explanation of how this grand challenge works. And I'll be talking more about how grand challenges work here on my podcast, but I wanted to do a deep dive into Stop Stigma Together so you could see one in action. And we'll be bringing on people on the podcast who are deeply involved. We've already showcased Daryl Kirch and Glenn Kreiner, two very knowledgeable people. There'll be more coming and talking about the grand challenge itself and how it works. So thank you for joining me. I'm Seth Kahn, and this is my podcast on grand challenges.